Hey everybody, Dr. Buck here, just waiting for Matt to tell me we're live. Happy Monday. So something that I wanted to discuss with you guys, with our patients, with our community. Back pain is the leading cause of disability in the U.S. Over 80% of people will experience back pain at some point in time in their life. And we hear a lot of patients, or see a lot of patients that are giving really not the best options. So I want to talk about where pain comes from, and then I want to talk about the options that people are given. So when we see people that have back problems, we talk about muscle pain and tension. Somebody will say, well, I pulled a muscle, my back went out, I had a slip disc. All of those things are relating to bad mechanics in the spine. So most likely what we're talking about is something down here, but it could be in the mid-back, could be in the neck. It's easier to see if I just show you up here. So there's two components that are really important with spinal biomechanics. So one is spinal alignment. So the positioning of the vertebrae and the overall global positioning of the spine. So we should have this C-shaped lordosis in the neck, and then that's equal, and it should be 42, 43 degrees. And then we should have a curve in the opposite direction, a kyphosis in the mid-back, and then another lumbar forward curve lordosis in the lower back. And the curves are there to give the spine balance and flexibility, and to create like kind of a shock absorber. So if I have something that's a stilt, a stick, there's no give. If something like one of those pogo sticks, right, a spring has give because of the curves. And so same thing with the spine. So the other thing is that we want to make sure that we have these curves, because if we lose the curves, now we're putting uneven stress on the disc, which again loses function and puts more stress on the spine. So, and also will cause us to lose, when we lose structure, we lose function. And so that will also cause us to have a spine that doesn't move freely and smoothly. So if somebody goes, well, I used to be able to look all the way in one direction and all the way in the other. Now I notice I'm having to turn my body to look at things, or my flexibility was better, or it hurts when I bend over now, those kinds of things. That's a lack of motion in the spine. The point of that is those are physical problems. And when we have loss of function in the spine, it affects these yellow things right here, if you can see that, affects those yellow things right there, which are neurology. When you affect the neurology, you affect the muscles, ligaments, and tendons. So the muscles, ligaments, and tendons are a reaction to bad positioning and bad function in the spine. We call it musculoskeletal splinting, so it's protective. Okay, or when we lose normal structure, we lose function, which creates instability and causes an imbalance in the muscles. Either way, the spine is the foundational thing that needs to be taken care of. There's other things too that are important. So there's sensors in these joints, and when the joints are working right, the sensor's working right. And when the joint's not working right, the sensor is not working right. So all along there, we're talking about structure and function, mechanics. There's not the chemistry component of this is the sensation of pain, or the accumulation of inflammation. So hopefully y'all understand that. The medication that people are given, a muscle relaxer, is relaxing a muscle that's being tight and tense for a reason. Guys, please understand this and think with common sense and logic here. The muscle relaxer is dealing with a muscle that's tight and tense. Pain medication is dealing with the nerve synapse, the sensory component of the nerve. Neither one of those things are the origin. It's not a malfunction. Back pain is not a malfunction in the nerve. It's a malfunction in the spine that causes inflammation. the medicine does not fix a physical problem. You can't fix a physical problem with a chemical one. And again, alignment and motion is what gives our spine health. So a back surgery takes away both of those things, alters the biomechanics, which is why the majority of people eventually have back pain again. And so, not that surgeries are never needed or that pain medicine is never needed, but we must address the mechanics and the function of the spine if we want to have long-lasting relief of back pain. And we see too often, even with other chiropractors, where somebody goes a few times and they feel better, which is great. We want to feel better as fast as possible. But if the mechanics did not get retrained and reprogrammed, that still is a short-term solution, and the person returns with back pain again, which is something that we try to avoid in our office by retraining, reprogramming, coming up with something that can change the mechanics and the biomechanics to something that has more stability and balance. And it's doable, but it takes time, it takes retraining, and so maybe I'll talk about that in another video. What's the difference between going to a chiropractor for 1 or 2 or 3 visits versus going to a chiropractor for 2 months? What's the difference? What are they trying to accomplish? Because it's a very, very, very different objective. We're trying to achieve different things. So we'll address that in the next video. If you have any questions in the meantime, guys, back pain is a major, major cause of problems for people. Please share this with somebody that's struggling with back pain and they're not really getting any good results, because we hear it really constantly. I tried physical therapy, I went to my doctor, I didn't get great results, and so now I've just been living with back pain. And it's the most common use of opioids in our country is pain related from the spine. And guys, it's just not necessary. If we could find find what's causing the problem and then get to the solution, it really can change. So hopefully this is helpful. Share this with somebody. We love y'all. Have a great week, and we'll talk to you soon.